Aloha. Thank you so much for joining us for today's webinar, The Benefits of Using Telehealth. My name is Dr. Dale Glenn, and I'm here to facilitate today's conversation. This Hawaii Pacific Health webinar event is focused on providing helpful information to the community on the industry shift toward virtual care, services available through telehealth, and the benefits of working with your care team using virtual health options. Before we get started, a few reminders for our viewers. Today's webinar will be recorded. After the event is complete, registered participants will receive a copy of the recording. The event will also be available to view on our social media channels and website. For those joining us live, please feel free to submit questions using the Q&A button at the bottom of your screen. We will do our best to answer as many questions as we can during the Q&A portion of the event. We are lucky to have several experts joining us for today's discussion. Dr. Ann Dempsey is an internal medicine physician who practices at Kauai Medical Clinic in Lihue. She is the Chief of Primary Care at Kauai Medical Clinic in Lihue. Dr. Michael Louie is a neurologist and neuromuscular specialist originally from the East Coast, where he completed his medical training. He moved to Oahu in 2012 and is Hawaii Pacific Health's Chief of Neurology at Palimomi Medical Center. Dr. Sandra Noon is the Chief of Primary Care for the Hawaii Pacific Health Medical Group. She is also a practicing internal medicine physician at Straub Medical Center in Mililani. Welcome, panelists. We've been through a lot of change recently with COVID, but it has also created some new opportunities. We've made connecting with your doctor a lot faster and more convenient, and our panel is here to share with you what these changes are and what new technology can do for you. So a lot of our new opportunities depend on a patient portal called MyChart. So let's take a look at how you would get signed up to use MyChart. If you go onto the hawaiipacifichealth.org website, at the top, you'll see a link for MyChart on the right side. If you click on that link, you'll find this has a lot of information. First of all, it shows you how to get signed up if you don't have an account. But second, down below, you can read about all the different tools that MyChart has available. So even if you've used MyChart before, you might want to visit this webpage and look at all the different things you can do with this tool. It will save you time and effort on the phone. Next, let's take a look at what MyChart looks like if you're using it for the first time. Can we have that screenshot, please? So once you log into your MyChart account, this is what you'll see. On the left side, you may see messages from our healthcare system or tips to help you out. On the right-hand side, there are links that allow you to view your most recent lab results, refill your medication. You can send your doctor an email securely through the Ask a Question button. You can also do something called an e-visit that we'll be talking about later that allows you to take care of a minor medical problem without having to pick up the phone. You can schedule an appointment, you can review your own health history, and even pay your bill online. So these tools are there to make it much more convenient and faster for you to access healthcare. Thank you for sharing that. So patients now have this wonderful portal that makes it a lot easier to manage their healthcare. Let's say I wanted to ask my doctor a routine question that didn't require an emergency answer. Dr. Dempsey, what would be the fastest, easiest way to do that?
Well, the fastest, easiest way would be to use the MyChart to send your doctor a MyChart message. For my patients, my MyChart messages go to my nurses first. So if patients have questions like, are my labs ordered before my appointment, or things like that, my nurses can answer them very quickly. Otherwise, my nurses forward it to me, and then I can ask their question. I can answer their questions as they come in. So it's really just an easy way to email your doctor if you have questions. And my patients send me a lot of messages all the time, whether it's questions about vaccines, whether it's questions about their medications, new symptoms they may be having. It's a really great tool, and MyChart is really helpful for getting them the care they need and getting their answers, getting their questions answered.
Yeah, I use it myself too. But like some people, I'm pretty healthy. And so for a lot of our audience, they may not feel like they need to communicate with their doctor that often. But Dr. Noon, suppose you have elderly parents you're taking care of or children. Are there ways to use MyChart to help take care of your family?
Yeah, if you think about it, that care team doesn't just have to be the patient and their doctor. That can be the caregiver, whether it's someone taking care of an elderly patient or an elderly parent, or you're a parent of a young child. You're part of that care team. So you should also have a way to be able to communicate with that team about that patient when needed. So it's it's a great tool for that as well.
So let me ask this as well. Dr. Dempsey, what if you need to get access to the MyChart account of a family member? How do you do that?
You can either call up at the front desk, or if you're in the appointment with your family member, the doctor can send you a text or an email with a link to the MyChart. But usually I think if you're doing it for a family member, you need to fill out a permitted communication form to be their proxy. I'm my dad's MyChart proxy, so I help him out with using his MyChart, which proved invaluable when scheduling his COVID vaccination.
Yeah, and I know my family uses MyChart all the time to help manage appointments for our kids, and even my daughter in college. Dr. Louie, we're glad to have you with us with giving us the specialist perspective. So how are specialists using this technology? Do you even use MyChart to communicate with patients?
We are. All specialists currently are using MyChart. Just like with your PCP, we send messages back and forth, just like an email with patients and their families, and for non-urgent questions. And we actually like this a lot better. The older method was to just make a phone call, leave a message. But with this, we have the ability to take in a lot of detailed information and respond back fairly quickly. And our staff are specially trained to triage these messages. So if they can respond back themselves. But if there's a more complicated question that the doctor needs to answer, they can actually forward it directly to us, and then we can respond directly to you to answer your question. And for myself, I personally use it to talk to my own PCP, and I love it. I think they love it. So I think it's a win-win for both sides.
So this is a really safe way to email and communicate with your doctor and other members of your care team. But this past year, COVID has really changed a lot in healthcare. Prior to this past year, we visited the occasional phone call to manage people's health. But now we've got a lot of new tools that have been developed. Dr. Dempsey, I understand that now through MyChart and through some other technology, patients can now do e-visits, video visits, and even sometimes telephone visits. What are these three things and how do they work?
Well, e-visits are like a MyChart message, but they're structured so that they ask questions that we'll need to know to take care of certain problems. So some types of e-visits would be, say, urinary tract infection, cough, rash. And it's really nice because if someone sends me an e-visit for a urinary tract infection, it has a structured questionnaire, so I know whether they're having back pain, how long it's lasted, whether they're having fever, all these different questions that I would be asking them in a back and forth fashion. So I already have all the information. I can read their questionnaire. I can, get them the care they need right there. So it's not a lot of back and forth. So the e-visits are like a MyChart message for certain diagnoses, but it already has all the information that we would want to know that the patient fills out in a questionnaire. And it's a great tool. I know, for instance, with the rash one, they can attach photos of their rash. So that's been a great thing that we can use. The video visits are just basically, instead of an office visit, it's scheduled on the doctor or advanced provider's schedule, and then they just are at home and they log on to one of our secure platforms, and it's a video visit. So they're at home, say on their couch, and I'm in the office, and I can see them through video visit, and we conduct the visit that way through video. Telephone visits, same way, except it's just through telephone. Those are less optimal because we actually do get a lot of information through the video. We can, see the patient. We get a lot of information just on how a patient generally looks. Are they in distress? Are they comfortable? And then if they're having pain, they can show us body parts. They can show us sometimes rashes if the resolution is good enough. So those are the different ways that we can do telemedicine these days.
Yeah, I've had patients send me pictures of rash through e-visits, and it's actually kind of nice. I can see what's going on and answer very quickly. So do I get to choose what type of appointment I want? And when would I choose one versus the other, Dr. Dempsey?
You can choose it when you schedule it. There is a way to schedule appointments through the MyChart where you can schedule. Also, if you call and make an appointment, you can tell them whether you want to do a video visit or regular. And also we have the nurses calling the patients prior to their appointment and offering the video visits before they come in.
So Dr. New, let me ask, what about vital signs? I mean, you can't always do vital signs over these visits. How do we deal with that, or what's the best way to get those measurements?
Well, that's again kind of part of the patient engagement side of it. I ask all my patients with diabetes and high blood pressure to consider getting their own monitors for home, and they can provide that information at the time of the visit. And we actually have a way to be able to document that at the time that we're seeing or listening to the patient. So again, it's another way to, as a member of your care team, to get involved in your care.
Yeah, I think it's great for patients to get used to the idea of checking their own blood pressure at home and even checking the pulse oximeter if they had COVID or some other respiratory disease. And you can then
Right.
report those same vital signs that your doctor would measure in the office. Dr. Louie, let me ask, how are specialists using video technology? Can you do a full examination over video, or what are the pros and cons from the specialty perspective?
Yeah, so it's actually great. To me, doing a video visit at least gets your foot in the door. I mean, it allows me to see you, hear what's going on, look at you and see your environment. And you can do a physical examination as a neurologist. I can do actually a large portion of my examination. Obviously, there are certain things that you cannot do, such as listening to the heart or the lungs with a stethoscope. And but at least I can hear your story, what your complaints are, what your symptoms are, and it helps me lead to the next path or the next step to get you to the answers that you're looking for, or maybe even to a treatment or the next imaging study or lab testing that we need to do. And if we do need to do something that requires the physical examination in person, we'll have you come in person, and we'll schedule that visit, and we can get to meet one-on-one. But again, the most important thing for me as a specialist is to get you into that, get you your foot into the door a lot faster to see that specialist or that provider.
So would you say the video visit is kind of similar to what we're doing right now?
Absolutely. I mean, this is a majority of my interview process is just talking to you and looking at you and hearing what's going on. I think as a physician and as a specialist, I mean, that's one of the most important things is hearing what your patient has to say.
And so, Dr. Louie, are all specialists using this, offering video visits?
They are, yeah. Hawaii Pacific Health has provided all the equipment necessary for all the providers, including specialists, to do video visits. And we've been using it since the pandemic started, and it's been wonderful. I truly love it. And once you start using it as well, I think my patients have told me that they love it as well. They can be at the convenience of their home, talking to their doctor, and most importantly, staying safe at the same time.
It's interesting because, my kids have been using FaceTime for years. Dr. Dempsey, why has it taken medicine so long to adapt, and what's changed recently?
Well, we were in the process of implementing it, but COVID-19, the silver lining of the whole pandemic was that it sped things up really quickly. One of the reasons was that the government established rules to make telemedicine covered by insurance. So the insurers were able to cover these video visits and telemedicine. We also had emergency authorization where we could use FaceTime and other platforms. Initially in the pandemic, now we are using, the more secure HIPAA compliant platforms. But that was a big piece in kind of catapulting the telemedicine. Also, just trying to reduce the risk of getting people in until we knew just how the virus was spread. So just trying to do things virtually instead of in person really just kind of catapulted us quickly into the next level. And it's been a great success. I think it just kind of put things into hyperdrive. Now we all have headsets and like Dr. Louie was saying, we all have the equipment and the capabilities. And for those of us on the neighbor islands, it's been nothing short of amazing because my patients now get to see the specialists on Oahu much easier than flying over there. So it's really improved access to care to a lot of specialists. And there's just been so many benefits to it.
Yeah, I think that's one of the big wins is just access to care for people who are far from a specialist or even who are stuck at home or in a nursing home and can't get out as easily. We're able to access a lot more people. that kind of leads me to another question. Dr. Noon, who tends to be using this technology, these e-visits and video visits? Is it the elderly? Is it young people? Who's adapting to this, and what have you seen?
It's been amazing, but I've seen it all across the age spectrum. And I think the value kind of depends on the patient. But I've had my 18-year-old patients use it. I'm an internist, so I take care of the youngest is 18. But I've had patients in their 90s who are very happy to use it. And the particular benefit for me has been of this particular type of visit has been to give me a set of eyes into their life, their daily life. So I just, if I can share this experience with a patient of mine, I had this elderly patient who kept, coming in to see me with bruises, and we're trying to figure out, I'm trying to figure out why she's got all these bruises. And she was saying, yes, I'm falling more. And so we ended up doing a video visit. And I said, hey, can you just show me, do you mind? Do you feel safe kind of turning that camera around and kind of show me what your living environment looks like? And I was able to see there were throw rugs on the floor that I think probably were likely barriers that she was tripping over. We're all now kind of because of the pandemic and what's happening to people financially, living all under, multiple family members, in extended families living under one roof. So a lot of times what was in the garage is coming into the home and getting put into hallways in some cases. And those for our elderly folks sometimes are unfortunate, can cause falls. And so this allowed me to see, it gave me a portal into her life to get a little bit more information so that I could advise her and help her improve the safety of her home. And I wouldn't have had that information otherwise. So I think there's value added to having this type of visit available to both of us.
Yeah, the classic family doctor always came to your house. And I think there's something we kind of lost when medicine became this centralized office-based practice. And now we've sort of brought back the house call. And I think it's a big win for us and for our patients. We get to see what life is like at home, and we learn quite a bit from that. Just as we, watch our patients on the camera, we also get to see their environment. So I think that's fantastic. Dr. Louie, let me ask you, what do your patients say they like about the video visits? What do they enjoy about it?
They love being able to stay at home and talking to their doctor right away. And before, I think for some of my patients too, before you be in a waiting room, let's say your doctor's a little delayed for whatever reasons, you could be waiting there for 15 minutes or longer. But now, well, you're at the comfort of your home. And if you're waiting for your doctor, a lot of my patients told me, oh, that's okay, I'm just watching TV. And so it's actually great that they can have that kind of convenience and the flexibility while at home. And especially with the pandemic around, a lot of patients are scared to go out. So if they feel safe at home as well, it's great for the specialists and other providers because we get to connect with our patients, and that's the most important thing as a doctor. We just want to connect to our patients, and this platform allows us to do that.
Yeah, I think patients like the fact that if they're in their own home, they don't have to wear a mask. It allows us to see a little bit more of them too. And even for the hearing impaired, where they're trying to watch lip read, they can't really see that in the office. They can do that more, and they can put on their headphones and crank it up too. So for some of our elderly patients who are hearing impaired, they say video visits actually work better for them. So let me ask Dr. Noon, what are some of the disadvantages? When does a video visit maybe not work?
Well, if you need to be able to touch, to feel what's going on with the patient, like examine the abdomen and not just look, I think it's imperative to bring a patient in. So that many times if we start off with a video visit and it's apparent that I'm not going to be able to get the information I need during that visit, we can easily within our team bring that patient in same day, typically, but if not, within the next 24 or 48 hours. So I think it's great to start with, but in some cases we need to bring patients into the office.
Well, that sounds very helpful. And I found in my own practice that there are both advantages and disadvantages, but just to let patients know, you got to have some good technology at home. If you want to do video visits and you don't have a great internet connection, that's probably the single biggest complaint I've heard is the connectivity problems, because we try to provide the best video link that we can, But if you don't have a good cell phone connection at home, if you don't have reasonably fast internet, you're going to find it really difficult. And in those cases, we'll often switch to a telephone visit if we have to. So Dr. Dempsey, let me ask, how do I, if I wanted to get signed up for a video visit, how do I do that? Can patients who don't have MyChart still do video visits?
Yes, they can. We can do the video visits through the MyChart, through the Epic, or we can do it through a different platform. Right now we're using DoxyMe. So what we can do is we can text them a link to the DoxyMe or email them, and they click on that, and then it takes them to the website, and they enter what we call a virtual waiting room. And then it shows up on my screen that they're there, and then I just click on their name in the virtual waiting room, and we're connected through the video visit.
So we still have this available, even if you don't have a MyChart account, you can still talk to your doctor on video.
Correct.
Dr. What would we say to people who are worried about privacy? I mean, is this safe? Is it secure? What concerns do we have?
It is safe. This platform is HIPAA compliant, and all the information travel through, the video is all secure. So I don't think you should have to worry about, someone hacking in or something like that. It's a very secure platform.
Do you have any other tips, Dr. Louis, that you would share with patients for a good video visit? What have you noticed makes a better quality visit?
Definitely. I've been testing this for the past year, just like other doctors have. And one thing I've noticed is that if you have at least 3 to 4 bars on your cell phone, that's probably going to give you at least a decent video quality. And the second thing is, if you're using your Wi-Fi, be close to your Wi-Fi router. That's your main internet device box. And if you're close to that, you get the best signal, and that allows the video to get through much better, the sound to get through much better. And luckily for us, over the past year, the technology has actually improved a lot too. So in the back end, I think the connections are a lot better than they used to be. But in general, if you do those kind of things, and you should have a great video visit with your doctor.
Let me just mention a couple of other things that are helpful too. Because we do want medical conversations to be private, find a quiet, private location if you can. Hopefully someplace where the kids aren't running around back and forth in the background. Make sure you have good lighting, especially light on your face and in front. If you want to show the doctor a rash or a mark, make sure that we can see it clearly. The other thing that's important is sound. You'll notice a lot of our doctors here are using headset microphones. So a good microphone and good sound will really aid the communication. So we'd encourage everyone to have those things set up so you can have a good quality conversation with your physician. If, for instance, we can't make the connection work, we might convert it to a telephone visit. Let me also ask Dr. Noon, let's suppose you have a video visit and you can't solve the patient's problem over the video. What do you do?
Well, I think we bring them in, and that's when we can work with the team to get them in and bring them into the office. Sometimes when video visits fail, we like, let's say the picture quality isn't good, or it stalls, then we can often transition. We've learned to be creative, and we can transition to the phone. And oftentimes I'll even, when sound goes out, I'll hold up a sign saying, "Give me your home phone number. Is it okay if I call you on it?" And we easily transition to phone. It's kind of fun. I mean, we both giggle about it, but we will endeavor as your team to get to the root of the problem and see you in the right setting. So it's really about getting all the information we need to provide good care. And if it means transitioning to the office, we'll do that, and we'll work with your team to make that happen.
Yeah, the video visits and telephone visits are all about increasing convenience, but our primary priority is safety. So we're going to make sure that you get a thorough physical exam and your problem is addressed appropriately. And sometimes that does mean we need to have you come in for an office visit. What would you say, Dr. Louis, what's the biggest barrier that prevents people from using this technology?
I think it's their own fear of the technology from the patients that I've talked to. A lot of them are resistant to technology or wanting to do a video visit. They've never done it before. Or another big one is they just don't have a smartphone. They don't have an iPad or a computer with a camera on it. And I think that's one of the biggest barriers. And for those patients, we just set up a in-person visit. But we do highly encourage all patients, especially now, because I feel like even after the pandemic is over, and this technology will be around. And I think that's a lot of doctors are going to continue to use this, especially, and hopefully the insurances will allow this to continue on as well. And I think it's worth it to invest into that technology. And again, once you try it, I think you'll really love it.
Yeah, I think that's been the biggest challenge for us as payers is this kind of technology, or as providers. This technology has been around for a long time, but prior to COVID, most insurance wasn't willing to pay for it or just wasn't available. They didn't have a billing process for video visits and e-visits and telephone visits. So now those things have all been rapidly put into place. So this should be available to pretty much everyone with every kind of insurance. But if you have questions, definitely check with your insurance provider. A question, I've just been kind of keeping one eye on the chat to see what people are looking at. We will get to these questions directly, but a question that's come up several times is that, how do we reschedule? What if we make an appointment and we need to change it? Dr. Noon, what do we do about that?
Well, you can actually send a message through the portal to indicate that you need to reschedule your appointment. You can always call as usual, but it's easy to also, under the schedule part of your dashboard, indicate that you need to reschedule your appointment.
Yeah, I did notice another comment here on the chat too, that people are having trouble getting through on the phones. And I will tell you right now, because of the COVID vaccine, which is our next community webinar, phone lines have been jammed, and that's just not here. I was talking to my dad, and he's had trouble getting in with his doctor. Phone lines at Queens, phone lines at Hawaii Pacific Health, phone lines at doctors' offices are being inundated by people trying to call through and find a way to schedule the COVID vaccine. And we completely understand that. So we would encourage you to use MyChart whenever possible to communicate, because it will save you those long waits on the phone. So if you need to change an appointment and you can't get through on the phone, for which we apologize, send a MyChart message and we will get to it and get back to you about that reschedule. Looking at some of the other questions we had here, Dr. Louie, do patients need to install any specific software on their phone or computer to be able to use these tools?
I think for MyChart, you just have to install that app on your phone. But other than that, you can access everything on the web. The DoxyMe platform is actually text message to you, so you can just all you have to do is click on a link, and it goes directly to that site. So you don't have to install anything. So it's actually very, very easy and very convenient.
So we've talked about some specialists that are available. Does anyone happen to know, can you see a dermatologist over video? Ask Dr. Noon that one.
Oh, no, I can tell you, we have a dermatologist embedded in our clinic, and she was one of the first ones that said, yeah, video visit, I'm all about that. And even if she needs a higher quality picture, so can't see what she needs to see during the course of the video visit, she'll say, send me a picture on MyChart. And she's been able to successfully take care of patients using that venue. So I would say yes.
Well, and thank you. We've had a couple of questions about costs. So Dr. Dempsey, how does the cost of these compare to a regular office visit for the patient or their insurance provider?
I know that sometimes they will get a copay, so we do ask patients if they're willing to pay the copay, just like a regular office visit for the video visits. And telephone visits as well, there can be a copay, and for some insurances, they have changed whether they're covering the telephone visits or not, but that'll be addressed at the beginning of the visit, whether there's a copay and whether they're willing to pay it. But the cost of the visit should be covered if it's a video visit still for now.
Yeah, and would you say generally the telephone visits, I know there are different ways office visits are billed, but I guess it depends somewhat on the complexity of the problem. Is that correct?
Telephone visits are billed based on the time of the call. So a 5 to 10 minute phone call is one charge, and then 6 to 11 minutes or that's how it is. I think it's like 5 to 10 and then 11 to 20 minutes. So that's all based on time for telephone. The video visits are basically the same billing as an in-person visit with a modifier that it's a video visit. So billed the same way.
So Dale, I'm wondering if part of the question was for the care that patients have received in the past. Just I have a quick question. It's not requiring a diagnosis of a new problem or an in-depth conversation. We have no plans to charge anybody for that kind of care. That's still the what we've covered in the past, and we don't plan on changing that at all going forward.
Thank you. I think that's a critical point to make, that
Mhm.
we still gladly answer questions over email. We still answer basic phone calls and basic questions over the phone. And if we're going to formally do an e-visit or a telephone visit for a more complex problem that requires much more complex history, we'll let you know that up front, and we document how much time we spent. So we'll make it clear that if we and you agree that that's what we're going to do, you'll be aware that this is a telephone visit versus just a telephone call, or an e-visit versus just an email. So that is something we need to keep clear. Video visits then have to be scheduled as appointments, whereas, your doctor may just call you on the phone, but we will decide if we're going to do a telephone visit separately. So one question I got, and maybe we could discuss this, is this visit an alternative to having a primary care physician? And I know for some young people who just want a quick check-in with something, they want to be able to use these visits earlier. But Dr. Dempsey, can we talk about that importance of the relationship with a primary care physician and how that enhances these visits?
Yes, I would encourage everyone to get a primary care physician instead of just, say, going to urgent care all the time, because as you build a relationship with a primary care physician, even if you're a really healthy person, knowing someone, I know my patients, I know their family history, I know what's normal for them. And just having that relationship can help me provide better health for you. If you're always going to urgent care, you're seeing a different doctor every time. Like, no one's keeping tabs on your overall health picture. No one's keeping tabs on your health maintenance. Like, hey, you're due for this, or you're due for that. And they're not seeing the overall picture, like, oh, you've had several visits for this, or oh, this lab was abnormal and maybe we should follow up. Like, you're not having that perspective of overall checking. So, now that healthcare is so much easier, like, you can do a video visit, you can do it from work, you can do it from home, but establish care with the primary care doctor so you can have that. You can also have a doctor that you can send a MyChart message to. It's so much easier now. You don't have to go to urgent care for your UTI. You can send an e-visit to your primary care provider. You don't even have to come into a clinic. You tell me you got a UTI, I order your urine culture, and then we can give you antibiotics if you need it. It's so much more efficient way of delivering care. And but to do it, you have to have a primary care doctor who's navigating and in charge of all those aspects. So
Can I
Yeah.
pipe into here too,
Yeah.
Dale? Do you mind? So one
Please.
of the other things, that the other way that I look at it is not just having somebody or bringing somebody else to your care team, but it's also about, a lot of primary care is how to be proactive. How do we keep you healthy? How do we kind of look down the road and see, are you on the path that you need to be on to reach your goals? And that is something that we can help you with as primary care providers. So I think there's a lot of value to having a primary care provider, and I would say there are different ways now to seek that care, right? You don't have to make the traditional in-office visit for that. That initial visit can be done on video, especially if you're healthy and not taking medications. So we can, reimagine what that looks like, but I would definitely advocate for a primary care provider.
Yeah, and I want to just point out a couple of things to our audience. We do have virtual urgent care. So if you want to make an urgent care appointment and you just need to get in to see somebody on video, we can do that for you. But that relationship with your primary care doctor is very important. And having a video visit or a telephone visit with someone you trust and someone you know is a whole lot more effective than having to meet a new person each time. So the relationship is also really, really important. Let me go to another question that was asked by our audience. Again, probably our biggest complaint is making sure that the technology actually works. And it was pointed out, do staff call early to help people set up the call? I'm going to ask Dr. Louie about that. How do we help make sure the patients are ready for their video or their telephone visit?
I think every clinic does it a little differently. Sometimes some providers will have their staff call ahead of time to make sure that everything is set up. I think most of our patients have been able to sign on pretty easily and without any problems. So typically we wait for the patient to sign on, but usually after about maybe 5 or 10 minutes, if we've noticed that they haven't clicked on the link yet or they haven't sent on to the to be in the waiting room, the virtual waiting room, we have one of our staff call the direct number, and we usually try to walk the patient or their family member through the whole process. And our teams are now, after a year of doing this, really tech experts in this. So they've been able to walk patients directly through the whole process and get them online.
Sounds good. Dr. Noon, I know that in primary care, we have patients in this audience who may not yet have a primary care physician. My understanding is they can get one right from our website. Is that correct?
That's absolutely right. And we would love to take care of you. So if you go to hph.org, our website, you can navigate to, I don't know, Dale, if you're going to bring it up, but I saw you moving down there. I don't know if you're going to move your mouse to show people how to do that, but it is easy to find, and we can help you get in with one of our PCPs.
Yeah, I won't put it up right now, but I
Yeah.
want to point out to people who are looking. If you use the physician search function on that same HPH website we showed earlier, hawaiipacifichealth.org, you can not only book an appointment right there with a new physician, but you can see which of our doctors are accepting patients, and you can actually read reviews from other patients. We publish both the good and the negative reviews that we get from our patients because we want you to make an informed choice. So I encourage you to go to our website if you're looking to find a new doctor. Let me go to a couple of more questions from our audience here. And this is a great one. Are there regulated hours for e-visits, like office visits? How do e-visits work? And are there different office hours for these other types? Let me ask Dr. Dempsey that one.
E-visits can be submitted anytime. It's like an email. So it'll just pop up in my e-visit tab on my in-basket. And we put a priority on those to try to answer them ideally within 24 or 48 hours. I think we're supposed to do it within 72 hours, but I try to do them faster than that. So you can submit it anytime. I would say that most of us check it during business hours, not on the weekends as much, but we do check those within 24 or 48 hours on the days that we're in clinic. But you can submit it at any time.
Yeah, I think that's one of the big advantages of an e-visit is you can put it in any time you want. At midnight, that's fine. But be patient and realize that we'll get to it, maybe a little bit later. And so that's only for problems that don't need an immediate answer. If you need something that's more urgent, either a MyChart message or probably a phone call if you're really feeling sick. Wouldn't you agree, Dr. Dempsey?
Yes, especially if it's something like chest pain or shortness of breath, that should be a phone call for sure.
And for some reason, that reminds me, I have to mention my personal pet peeve. Please don't try to do video visits while you're driving in your car.
Yes. Or a passenger in the car. It's still not great.
So make sure you're sitting down, focused in a quiet, private place and safe. We want the technology to be convenient, but we have to be careful too.
Or walking through Walmart. I also did that one.
Also not good. We've seen that one as well. Dr. Louie, have video visits allowed physicians to take on more patients, and have they helped sort of with the access backlog we sometimes have getting to specialists?
I think definitely with the access, and with the pandemic, if it wasn't for this, our volumes would have plummeted, I think. But with this technology, it allows us to see, if not more, but at least just as many patients as we were seeing before. So it's keeping us very busy, and it's been wonderful for, I think, all the doctors, and especially the specialists too.
So I've got a couple questions here on changing doctors. So Dr. Noon, what if I'm not completely satisfied with the primary care physician I have right now? Can I change?
Yes, I would say it is like in any other situation. You want to be, in order for you to have an effective relationship with your doctor, you need to feel comfortable. It's hard to talk about some of the things that we talk about with our doctor unless there's that level of trust. And sometimes, no matter how much we try, that doesn't happen. So when that doesn't happen, we want you to find the right fit for you. And so if you can certainly call the office, because I would imagine you're going to that particular clinic because that's where you live or where you work. Or you can also express that wish to schedule with a different provider through the MyChart portal.
And Dr. Louie, would you say that's true for specialists as well if patients feel they want to change specialists?
Absolutely. I mean, even with specialists, just like any other provider that you see, you have to feel comfortable talking to them. So it's always your right and your choice to choose who you wish to see. And I definitely feel that having that comfort with your provider is extremely important.
Yeah, we really do recognize the importance of that relationship, and we do everything we can to support it. Um, Let me ask another question here from our audience. Do our physicians try to review records before the actual visit? Dr. Dempsey.
Yes, we do. We look through, and I think the best thing about Epic, the electronic medical record that we use, well, is that you can see so many things from different sources. Now we have Care Everywhere on Epic, where it pulls in records from a lot of other places. So you can see if they went to different places, and I'm able to review what happened from since the prior visit, if they went to urgent care or they went to ER. I know that's a little bit more limited on Oahu with different providers maybe not being on Epic, but it's invaluable because you can click on different things, and with the Care Everywhere tab, even if it happened, say at Queens, because they're on a different system, I can review a lot of the information on there. Sometimes it's not everything, but a lot of times it is, discharge summaries or specialist notes. And I do look through all that, and it helps us look through and get a good broad picture of what happened since we last saw the patient. So then when I'm walking into the visit, I can be like, oh, tell me what's been going on. I see you went to urgent care. Looks like you fell and hurt yourself on the sidewalk. What happened there? And, that just happened today. So, we definitely do that. And your doctor should.
I certainly, we certainly want them to, and they're certainly encouraged to. That the way you explain that brings up the answer to another question. One of the advantages of this system is we do have access to records from Queens and from Kaiser, but unfortunately, some hospitals are not on the system, like Castle and Kuakini and some others, and there's not much we can do about that at this point. I think it's a good question. Our goal is to have all the information in one place and have it accessible to you as a patient. Ladies and gentlemen, that's about all the time we have now for questions, and we really appreciate you joining us. We want to thank our panel of experts today for their time during this program, and to all of our viewers. We hope you were able to take away some useful information about our telehealth services that can benefit you and your families moving forward. Please note that on Thursday, February 18th, we will host a special webinar focused on the vaccine that will feature experts from Hawaii Pacific Health, the State of Hawaii Department of Health, and the University of Hawaii John A. Burns School of Medicine. Registration is now open, and a link will be provided in our Mahalo email to all attendees. If you have any questions regarding our services or today's webinar, please visit hawaiipacifichealth.org. Thank you all for joining us today, and we hope you'll stay safe and healthy.